Hello, everyone. I'm Dr. Emily Wood from the University of Sheffield. I work on the Strategic Research Alliance, a partnership between the university and the Royal College of Nursing. The SRA is a large programme of work covering many themes, including advanced nurse practice, trainee nurse associates, district nursing, missed care, challenges in adult nursing, and research capacity building in the nursing workforce. If you're interested in this or any of the wider SRA work, then please follow us on Twitter for latest updates, or you can see the final slide for our website. I'll be talking today about some of the work we've been doing with advanced nurse practitioners and how we have followed their experiences of the pandemic and what those experiences are. Yeah. The cohort study with advanced nurse practitioners that we've been running has just closed. The little dots on the map represent the approximate locations of our participants. We have 243 nurses on the cohort, and every year for the last 4 years, we have sent them a survey to see how things are changing over that time period. The study was planned in 2018, and we initially recruited in the winter of 2018-19. The members of the cohort are self-identified advanced nurse practitioners rather than only people with AMP job title. We made this decision due to the lack of standardisation of AMPs across different organisations. To illustrate this, our AMPs cover 5 pay bands within the standard NHS pay structure, and the job title of AMP was represented in every single one of these pay bands. These people cannot possibly be doing the same job, and this lack of consistency has been a barrier to advanced nurse practitioners achieving their full potential, because it causes confusion over what an AMP can and should be doing. Due to when the cohort was planned in 2018, we have 2 years of pre-COVID data, which is 2019 and 2020. Our 2020 data is pre-COVID because it was collected at the end of February, beginning of March. And we will have 2 years of with COVID data, 2021, 2022. Because of the emergence of COVID-19, we did make some modifications to the survey in the last 2 years. So the final 2 years were slightly different. And during the first stages of the COVID-19 crisis in the UK, there were multiple anecdotal reports about staff safety concerns, lack of equipment, delays in patient care for non-COVID related illnesses, and AMPs being in senior roles with clinical and leadership responsibilities within the NHS and associated organisations were well placed to report on clinical issues in their areas and in the wider organisation. So with that in mind, we were able to be quite responsive. And we undertook an additional survey in June 2020 to look at COVID specific issues. And there are papers for that out on the website. So over the 4 years, you would always expect response rate to drop over the cohort of over the lifetime of a cohort study, excuse me. The fact that it went back up in the final year suggests that something unusual was going on in 2021. Given that this was March and the end of our first winter with COVID-19, then I think unprecedented is probably fair. So it did go down that year, but we're not too worried about it. There's a good reason why. Over the 4 years, advanced nurse satisfaction with pay has been fairly stable between 50 and 60%. It's not a good response. You'd hope more people were satisfied than that, but it's a fairly stable response. Equally, the well-being score, which is the SWEMWEBS, it's the short WEMWEBS scale that we used. Again, that's been stable throughout and not significantly different from the UK average. The percentage of staff reporting work-related stress has been high every year, but spiked to 50% during the first year of COVID. This has gone back down, a sort of regression to the means by the looks of things in the final year. That is interesting in itself, that people are not reporting work-related stress themselves as much, but 2/3 of our respondents did report ongoing safety and well-being concerns for their colleagues elsewhere in the survey. Participants reported major concerns for colleague well-being, especially around stress, burnout, and exhaustion. The main causes for this were listed as overwork, poor staffing levels, and worryingly, a large minority were reporting harassment and abuse from patients. Um, the percentage of staff considering leaving has also reduced in this final year, but we didn't actually start asking this until uh, the final 2 years. So we're not sure if this has returned to pre-COVID levels or not, but it is good that it's going down. So almost every nurse, so 90%, said that they were ongoing changes in service delivery in their area. Again, that's not particularly surprising. Um, but what we did see was decreasing numbers of advanced nurse practitioners reporting that they were actually involved in that change. So these are some questions that we included because they were some of the ones that used on the NHS staff survey. So it makes it nice standardized questions. Um, and although some AMPs reported things like heading up new services such as vaccination clinics or taking on roles that medical colleagues had previously undertaken, so we did see an expanding of the scope of advanced practice because of COVID. But it seems that AMPs aren't always consulted in the way these changes are happening, and this has been reflected in the survey questions. Um, Advanced nurse practitioners are a senior experienced staff and they have a role remit that should include some leadership, and they should be considered clinical leaders. And this doesn't appear to have been happening in everywhere, and there's some evidence that this is reducing in the number of places where this is being this skill set is being utilised. So although these numbers are still higher than the NHS average, which we would expect from this role, and the reductions are not statistically significant, however, they could well be clinically significant for the people who are working in these areas. And if this trend were to continue, it would quickly become statistically significant. It's very, very close to that. And as we know that being able to contribute to change, being able to innovate, feeling like you have some autonomy in your role. These are all things that are significantly correlated to good well-being and lower intention to leave. So ensuring that people actually have a say, particularly when they have a skill set to be able to contribute significantly, is really important. Ooh, sorry. This is also reflected in motivation responses at work. So there have been reductions in motivation over the period of the cohort, including some quite significant reduction in the number of people looking forward to going to work over the last year. And again, this is important because good motivation is significantly correlated with good well-being and to good job satisfaction. And then the last element that we wanted to report was about quality of care, the quality of care that nurses feel that they are able to deliver. And the quality of care had been increasing, but it has again significantly dropped off in this final year. We did ask some questions around consequences of delayed care for patients and whether that was being seen. 85% of our cohort responded that they were seeing consequences of delayed care for their patients. A lot of this was around longer waiting times, people not being seen. Most of it, people felt that they were managing the best they could, but there were problems with the actual pathway of care. So people were struggling to refer people to specialist services. emergency departments were reporting that they were getting uh, large numbers of people coming to them because they couldn't get a primary care appointment. Primary care then could refer to secondary services, so they were seeing more people. So there was pressure on those services that were um, kind of clashing against each other and causing a bit of a vicious circle. There were also issues for inpatient services that were struggling to discharge because there were longer waiting lists for home care. There were issues accessing social care for people. So each section having issues is then impacting on other parts of the care pathway as well. So it's getting harder and harder to treat people in a timely manner, and people were reporting some quite concerning delays for some of their patients, particularly around things like cancer and mental health. So to conclude, despite concerns for the well-being of colleagues and patients, the self-reported well-being compared favourably with the UK average, which was quite surprising to us. Um, Previously, nurses have reported high autonomy levels, and they still have higher than average autonomy levels. Um, but there is some evidence that possibly due to clinical pressures that this may be being lost. Um, the impact of COVID-19 has unsurprisingly been huge. It's not entirely been negative, although there are obvious negative issues around quality of care and the pride people are able to take in their work, just because there's now so much work to do. But there have been positive aspects around team working and people coming together. So finally, advanced nurse practitioners are highly skilled and very experienced. Innovation and broadening the scope of advanced nursing was accelerated by the pandemic, and this is a good thing. But these gains must be maintained and lessons learned for future development and support. All levels of intention to leave could then be a problem for this group as well, as it has been with others across the NHS. So just to say thank you to the rest of the SRA team. Um, Papers are available with no paywall from the website, and thank you all very much for listening.